bale water po esefusi walora. Ya motori dem konewe zina bibiri algabara tibele chere lora. Zina me dona tite umpo. Onda bulu vire gire so mi zore guare aya titenya malo yana onda bulu zore guare ba mi zore vire aya titenya ba fa yawe ya motori dem yerete zina bibiri alzabara tibele sira lura atina me dona titempoka pomi bale water po esefusi walora ya motori dem yerete zina bibiri alzabara timbe sira lura tina me dona titempoa Pelena le larata ti po pelena dota mena ti teunka pelena ti po pelena le larata ti po pelena asiti wana ti teunpo pelena ti po pelena le larata ti po pelena ti mi pa teri doruzie pelena ti po pelena le larata ti po pelena ti mi pa teri doru yiri pelena ti po pelena le larata ezako na ni tona ni lanta no be lazin yare pelena ti po pelena le larata Pelena, Sintimena Titeunka. Pelena, Pelena, Dota Wana Titeumpo. Pelena, Etipo Pelena, Timipa Terry Doruzie. Etipo Pelena, Timipa Terry Yabaru Yele. Etipo Pelena, Yambaru Wana Titeumpo. Etipo Pelena, La Filo Wana Titeunka. Ezakena Tinkwendere Lantano Ben Laziere. Ni Lantano Bena, ni Lantano Ben Balazie. Etona Wana ni Lantano Beno. Ipo Pelena, Asiti Wana Titeunka. Etipo Pelena, Dota Wana Titeumpo. Tipo Pelena, Dasiti Wana Titeunka.
Thank you. We will call on the Pendana to press on the
Ola ina to ke e de puri ani wayan ani ta be ada ko ton o ta ba do ola no to me bo e to me nye a puri dem te ba barbaro a bi dire be puri a so a be nu ta to ne a bi dir mi e po do ba yiri awna be wa be me ta to me pa bi bir o ta ye to palo ni wona e era ero ti twali aju abu da kwe tingan abu jua ko baranya e bunu yide o yi aya baro apauri a sabe puri e tinya ya baro ala kwe to bo da kwe to mu to yo e ti ya gele e ya lidi ul ko bare de ko nya kan e ke ada kwe tingan na bibia o metera sabar abe ya ko me into ike e bola ahun dide onu ya ko ide ko baro nyawo yino e ko sati mi zamo sina nyina ya tin biyo ani ko bara nya ani ide o ya yamba.
The driver cannot function alone without the passengers supporting the driver. When you make too much noise in the vehicle, I cannot hear what is happening, whether the tires are creaking or not. So I'll accept this important assignment and ask you, plead with you to help me steer this car to a successful end.
I must say I'm very, very excited to be part of today's program, launching of a Center for New Life. As a mother and a woman, a midwife, somebody interested in children, I'm more than excited to be part of this program. And I want to thank my regional director for making me part of the program today by assigning me to be a caretaker director of the Lawra Municipality. Nusale ni poyalem, a regional director irime in wakare and in Nora. So ane kanglem, yeah, at the director Obarka Yaga. I'm sure maybe it's not by coincidence. And I'm really irime in wakare and Nora Palo and the director Walewa. So director, I thank you. This is an area that I'm interested in, and that's the first program I'm participating in since I reported in Lawra district. And I know everybody plays importance to this thing, and that is why today is even Lawra Market. We all know what our market days are, but the turnout for the program is so massive. I'm glad that we've had many people taking part. This indicates the importance that we all attach to this program. And for health research, our partners, the resources you have spent on this thing shall be replenished in 1,000-fold. You are helping to bring new life. Whenever a woman is pregnant, the family becomes excited and making preparations to see the new life. And you are bringing that new life to the people of Tong Zarpe. Our mothers used to travel more than 10 kilometers. The Tindana mentioned it, either to Lawra or to Japa, which is very far away, in this scorching sun, to either go for antenatal care services or to go for skilled delivery. That is where they could get it. And the roads are not motorable. The means of transport is not there. And so for you to think of us and bring out such a project, may God bless you. So I want to say we are all happy that we have found time to be here. And just like we are attaching importance to this beautiful edifice, let's make good use of it. As part of my welcome, I'm saying that we, the people of Zarpe, Honorable Alexis, bravo to you. you are really a son for thinking of the mothers of your place and the new ones, those who will grow up to come and succeed you. May God bless you. So as they hand over the place to us, on behalf of my people, we are assuring our partners and the donors that we are going to make good use of the facility. We will use it for the intended purpose, get the resource, especially the human resource. My director just asked whether there were midwives here, and the assembly member said we already have 2 midwives assigned to the facility. And so everybody is excited to have it and ready to utilize it. So ladies and gentlemen, I'm welcoming all of you to this important program. It is my hope that we will all participate actively. Let's have time to sit down till the end of the program. We know it's Lawra Market, but I believe strongly the way we are going through, things will end successfully and we'll go and continue the others.
This is because we are witnessing this ceremony for the first time in the history of this community. We cannot hide our joy. That is why at the intro we were singing, drumming, dancing, laughing, and jubilating. It will take a long time for a similar thing to happen. Mr. Chairman, the Tomo and Zakwen communities have prioritized health over any other thing. And we were fortunate to have this CHIPS compound launched in 2015. And since then, the community have been given a role to play by owning the facility, taking part in decision making at the facility, planning together, implementing, monitoring, evaluating, and continuing the cycle as such. And so we constituted the Community Health Management Committee to work with the health staff here to realize what we need in terms of health as a community. As part of our responsibilities, we prioritize maternal and newborn care in our area here. And we took the initiative to construct this muddy structure at my left, which was not fit for purpose. We didn't end there. We took another step to look outside the box, to reach out to people that could help us to get a fitting structure to serve as a maternity unit for our CHIPS compound. And during one of the Community Health Committee meeting, the idea to draft a proposal was born. And as the assembly member and as a co-opted member of the committee, I led the process, and through the then director, Dr. Bernard Siem, the proposal was submitted to health resource partners. Unfortunately, on our part, it was approved based on a very important condition, that the community contribute anything labor, while health resource partners take full cost of the materials needed to put up this building. That we oblige as a community. We did our bit till finally the structure was raised and completed. Still in the same vein, we met to evaluate, and we realized that a structure without equipment would not still achieve the purpose. And so we drafted another proposal through the Municipal Director of Health Services to Health Resource Partners again, to help provide us a source of lighting at night. In our area, most women give birth during the night. And also to give us the necessary equipment needed to operate the maternity block. Fortunately, again, that proposal was approved. And today, we are here to witness the commissioning of the maternity block. Mr. Chairman, Tongo and Zakwen communities are not the only communities under my care as the assembly member of the electoral area. I have 4 other communities that I'm responsible for. And in these 4, we equally have chiefs compounds. The Konyukum Metobo chiefs compound is 1. And then the Toliru Meto Yipal chief zone is another 1. That one is without a structure. And so the nurse moves from Lawra to the community to work and goes back. In the case of Metobo, there is a structure but just a room for service delivery. And so they are equally suffering the same thing of getting the privacy for women to deliver. Mr. Chairman, as Oliver Twist, we will always expect more. And today we are fortunate to have the Regional Director of Health Services in our midst. We have the health resource partner that supported us to raise the structure. We have the Municipal Assembly, and we have my own leaders of the 6 communities here, including the unit committee members. As we thanking you, health resource partners, for the support you've given us, and also thanking the Regional Director of Health Services, the Municipal Assembly for being here, we are still appealing to you to help us have a similar structure at Metobo, and also have a structure for the Toliru Meto Yipal chips. I want to take this opportunity to acknowledge the contribution of some people in making sure that this edifice is put up. The artisans who devoted full time to work free for the community. Mr. Albanus Koning, who did the architectural work free of charge. The landowners that release land free of charge for the construction of this place. Mr. Chairman, ladies and gentlemen, we have done so many other things to support health delivery in this cheap zone. Provision of security at night, paying an orderly to keep the place clean, the community volunteer system where we have somebody move with the nurses without pay, among many more others. I want to, on behalf of my community, acknowledge Mr. Lawra Municipality. For the beginning of this church compound, he has been there as the security man up to date. I also want to acknowledge Goladel Potu, popularly known as Boy. These are the people who leave their wives and their children at night to come and protect what belongs to the entire community. Diantinara, Tiekeni yi never poor, Tipu in Barka, Tonku Desayana, Nimona. And now United Minakoi and a young Yuri. Eche, Nicha Juni. And me bob in Lake, Sumnena Mewa Pira Sayata, me Barka near with woman and me de were as ye viela. I say a yuko to all of us, and God bless us all.
Popielo ane amparo na wanime akazina. Intibina ka Lawra Health Directorate ya District Director. I avune po mane Honorable Alex Titoni Tomi. Our time come emi wari aka sounds zina be ya first time na waka ewa wanye a building na nyina ma agwalo ka ale kwa office ma na otisin here ipa ke o ko yide ni more pa ale nyina to lantar a ebukan nyina boke nyide so ni pobe ni mona ni dere nyun so etere so nu kan zie kan for what vua ma proposal wane inyela wa bara be kore Alexis wana proposal wa bi eke director I never boria adota yi te boka de liere a oneti na ma ani bopala atun de adole bibi adole pobe ton zakwe na lantara ni tuona a iguluke ni deni anyi la felu gile ani mimisie alanta beti kabia tebedi te no ben ati yarupo ani ati pepua te koton lantar a ianai mami beti nye manu sana wuke ana tuona iaka ina yela kube azina nyita jene o nyima jene bia no pe na wana bezo anyi aliviewe because of mob na nyina muora ka ana eminye so akokere na nyina ter irani anyi tumia ti bembe ebele enyana ke maso abona waka ananyani malo na sapelebe kuona pele na lurat parliament assembly na ire wahala ebe songa atentenza ba mikuona pele yagaza so lena so tutuo alantar amale azina wati debana to anawata eti yu azia honorable tuna bolike Dr. Ziem zafuna bea wate vua waka tewa waka nyele tuna tuo lantar ayu azina na ngmana ya ngame kuo auke tsalebe so amalo na tuo tatitio so ni keto jirwana nyekume ina wana because atomene ina dil yana nyinurupwa nyibe ya mavie nyitwana tu asonza atitale tunabora I have resource partners lale tonu abi amalazie we kama belale til podo gadori tipompo alura paluka atumani namdomsa asola lati anabena ya be ina mine anadom bupusin chips compound abimi mana zina be meeting bere po banga be yeza abe me libi pen ka ona betere be da de pili file niwe zina be metizere awul anana ti dia libi ware ti wa ya Ghana po libe ne libi maro dem be po apelia be irigo kan atere so nasala mi ke titere ambition tina titere tiero ke tina tona igele gan ana tina ira so atim tonza kwa community na dey a project na temeba nyovla apori ye journalist de lewe biaka bibi kan be o ma photo aka azie atokori Lawra na ebono ebe bere azie kezo o diagona bi obere arne le unatimwe apil sana ana inyo fa ku atiteuna so boy zeli ationdemza ni dia bona o echotabla apona na so ne ole na mala a NGO tituo nyali biwana odena azie na yor pura osan yor ayona bena mayaka osan yor awuke so chirzana udi so nenete So timi you to so chiri asaudi aziena atero villa clean azie villa zie ka mi asa director ni so phone to mal phone tik gu azie so that bibi kan ni ka ta o ike ebe deni zivla akoton za ko edem bebe azie san ma advice ne inatel na kwa community na aniale indicated that when the challenge was thrown to me to support, identify a community that can give the necessary support or meet its part of the deal to provide labor, I did not have any doubts that Honorable Alexis and his community would be the best choice in this locality. Because on their own, they started this structure, which I shared with HRP in the early days of the planning for this project. And relying on that trust, even though I left in the course of the starting of the work, I was still confident that this community will do its part. It is not the same everywhere. There are some places you go, and before you realize, quarrels, petty disagreements will lead to a failure. And this is, to me, one single reason why I felt that it should be here. Because I could have the trust and I could be part of the process. So it's an honor to be here, and I cherish the presence of all of you, coming all the way from the US. My own regional director leaving his work and other tight schedules to sit here. To me, it's a mark of a new beginning. It's a unique occurrence that we are lending great importance to. And I have charged the community never to let it be the case that one day somebody comes here and reports that the project is abandoned, some maintenance issues are emerging. I'm charging the health authorities here, the municipal director, the health workers, and the community health committee members to accept this challenge to maintain the place just as it is, so that the maximum benefit of it will come their way. Yeah. So I thank all of you for this privilege to be here and to address you and to share my words and thoughts. And it's my hope and prayer that more funds and resources will come the way of HRP to meet the needs. As we speak, we are getting more and more requests from various communities asking for help in various ways. I believe that the evidence that we carry along, the future feedback that we get from this will contribute to our ability to amass more resources to help other communities that are equally in need. I wish to say thank you, and let's enjoy our day today. Thank you.
Dr. Miti Yab, Bono Region, Waka, Regional Director of Health Services, Miti Yab is Waka, Municipal Director me, T. Jirapa, Ola no Karaka, New Winnie, Nandona, Nipemi, Wapo, Ebezawa, Nina Nabawa, Zakwenton, Abonayana. As we are yelling a benanoga, Ede Cotia, Neta 20 de Lobere, Nyogo Flavula, and a stone tuna. Any chance the latter time, Ube a malo chawa, yaga, Lebanai. Simply telling my people, in fact, Thomas the French people are mine people. I reside from this vicinity. I'm telling them they have to thank their staffs sincerely for the support that they are getting from all these people, right from the US through Ghana to Lawra and Nando. So they must be very grateful.
I'm most grateful for your partnership. That's what we are at Health Resource Partners. We want to be partners to everyone in the community. My name is is Britany Ferrell. I was a Peace Corps volunteer here in the Lawra district from 2010 to 2012. And during that time, unfortunately, I fell ill with malaria 3 times in the 2 years that I was here. And I struggled to get access to resources, and I just had to sit at my house and drink some local tea and try to get better. Thankfully, I recovered, and after my time here in the Lawra district, I went to study public health, and I wanted to bring access to people so that they could have the resources they needed to help themselves in the community, like your great community here. So I'm so happy that this project is one of our biggest projects to date. Since we started in 2018, we've been partnering with local communities to donate maternity beds and solar lighting, and also to help refurbish and renovate some clinics. But this, again, is our biggest clinic that we've built to date. Thank you, Berika. So because it's such a great honor to have the opportunity to build this clinic, I also wanted to honor my late father, Dr. Bruce Ferrell. He was a physician in America, and he helped so many people. Unfortunately, he passed when I was only 14 years old. So I'm very honored that the community allowed me to build this clinic to bring new life to Ghana, because my father is late, and so it's an honor for his name, Dr. Bruce Ferrell Center for New Life, to be represented here on this maternity block in Tongo Zakpi. Thank you, Berika. I'm very happy, and I'm most grateful. Thank you very much. Jeremiah.
So, ndada bo male buni zona era ani meti asia. Oye otubena Ghana ka atone Peace Corps volunteer to no. Otubena ermo senior high awule bibi. So na wa Ghana ka avune poa balo kam ba na malaria balo ba na. Bata nna me found. Te ba malaria me kure na o. But abeton ko. So ala yanga we me say obeton nye ambao na te se onya. Ba me say abeka be na so obeton nye ade be bona anya na. So na wala chin barrier we me de ala me ala bona mo na ton e. Am ton so agana dem. Bi alusa palo po nya na do palo po na da tonya. So ala yanga na o form of organization you the Health Resource Partners. So na form organization nga ubena Lawra ni na don palo po na una tonya e board Dr. Ziem era circulating na belori. So asa osandoro mga be kabe ba sa maintain physician America po. So na me azikwenga atumene zana tuna palo nga po as bon kwen pa na tonya nga. So ala ano me se ona zelna community ni wasaga purazinga yur ausana be kabia. So asa yura Dr. Bruce I've seen him that Ferrell. So also we said Dr. Bruce Ferrell Center for New Life. So the zelna sor regional director z okote sor emzel sor na community anakote aso abeton name azinga after osa na be kabia. So puni ne barka yakapa ya no songwe za na songwa na me fa na kana puri zede na me kunjo bugogo e ko chelo amina la wana te ba be salie ba bola china wana wanye buni na be kabia na kana puri zede na me kunjo bugogo amina lewa ala sa ko wa ka ba tona wa Lawra palo po bia na do palo po to ne barka yakapa.
Thank you. Thank you very much. Thank you. We need to continue with the program. Thank you very much. Let's give them a round of applause. Okay.
Thank you very much for extending an invitation to me to be part of this colorful program. And I wish to convey my deepest appreciation and that of the Regional Health Directorate to the chiefs and elders of Tongo Zakwe, the HRP partners for establishing this wonderful facility, which will go a long way to expand access to service delivery for the people of this area. Indeed, when I saw the invitation, it was just yesterday that I returned from a journey and saw your letter in my office. There are a number of activities currently ongoing in the region. The annual performance review meetings are currently underway in many of the districts and other important engagements. But I have prioritized this program for two main reasons. I am informed that the Community Health Committee in Tongo Zakwe is one of the best in the region. And that has been confirmed by the assembly member for the area who enumerated the steps that you took to arrive at your critical needs and what you did about that, which culminated into the establishment of this facility. The second reason is that we do not take the support of any partner in health for granted. So if HRP has mobilized resources, support the community to put up this edifice, which will serve the needs of our people, which would have been our responsibility, then it behoves on me to be physically present at its commissioning. So I take the opportunity to congratulate you, the chiefs, and the people of these two communities for the energy, the time, and your resources that you put in place to ensure the facility is completed. And to also congratulate and express my deepest appreciation to Britany Ferrell, the HRP, the country director, and her family for this initiative. She enumerated her experience in the region and the district during the 2 years of the Peace Corps volunteer. I imagine 10 years ago, the level of development in this district. And she was able to spend time. At that time, access to health service was really a challenge. Electricity and social services were very limited. And for her to spend time here to serve our people, and I see that was not enough. Using her experience in accessing health to mobilize resources to come and support us to put up this facility, I think that she deserves a big clap. It is my hope that The people, the chiefs and the people of the area will soon bestow on you Pogna, which means a queen mother in the area. I mean, it's a developmental title, and we hope to see that done. Mr. Chairman, this facility that has been built is to the memory of Dr. Bruce Ferrell, and I believe that his legacy will live forever. The children who will be born in this facility will serve as a reminder of his legacy. And I want to appeal to you all to first of all prioritize health service seeking around here. Before the CHIPS compound was constructed, I believe you had to travel several miles, sometimes with difficult means of transport to access health service in Jirapa or Lawra. And the facility now will serve your needs. So help the health staff here to operationalize the CHIPS and the maternity unit. It will help really reduce some of the problems that we encounter as a health service in delivering services. The pregnant women will now spend less in coming here for your checkups. If you have to spend up to 10 cedis to get transportation to Lawra, now you can easily just walk here and save that 10 cedis on transport so that you can be examined and given all the needed services here. And when it is beyond the level of the staff here, they will facilitate your movement to the next level without difficulty. So I hope you will be able to support the health service staff here to make the facility fully operational. And to the health service staff, the midwives here, we are here to provide basic services, including delivery of uncomplicated pregnancies. Know when your capacity is exceeded, and then you refer appropriately. We don't want the facility to be a source of problems, deaths of children or mothers in your attempt to be jack of all things in the community. So you should be able to identify your limitations and then link up with a higher level to manage. Referral is part of treatment, so that should be made clear to you. Again, let me point out that the Ministry of Health and Ghana Health Service has prioritized the use of CHIPS to expand service delivery to the people of Ghana. In the Upper West region, we have demarcated all the communities into CHIP zones, 450 CHIP zones. So every person born in the region or currently living in the region falls within a CHIP zone. The people in Lawra community, you have 50 CHIP zones. And out of these 50 CHIP zones, 39 are currently functional. We call them functional CHIP zones. It means that the community members have been mobilized, they have been sensitized, and they have agreed to participate in health service delivery. And the health service has assigned a community health officer who has been trained to provide services in these communities. What it means is that 11 of the CHIP zones in this district currently do not have designated health committees and then health staff to stay within the facilities, within the catchment areas to provide services. Out of the 39 functional CHIP zones, only 17 of them have CHIPS compounds. Basically, a CHIPS compound is a structure that has accommodation for the staff and also a service delivery area. So where there is no CHIPS compound and there is no place for the health staff, it means the health service, the health personnel has to trek every day to the community to provide health services. And that comes at a cost to the community and the health service staff. Because apart from travel costs, his or her availability throughout the day will not be guaranteed. Currently, because you have a facility where they are stationed here, you can come at any time, including midnight, and knock at their door. There's a security man who will wake them up and they'll attend to you. If there is no CHIPS compound, the staff has to come all the way from wherever he or she finds accommodation, and then they will close. Maybe by 5, they close and go. I know sicknesses fear no time. They don't respect time. When someone is in labor, they will not tell you to wait until the staff comes. So when they come, there's no health staff, and you have to travel all the way. So I'm using this platform to appeal to all the stakeholders, including members. I'm told that there are some communities who do not fall within Tongo Zokpe, who are here to listen and also share in the experience of these two communities. Learn from their communal spirit and take those lessons to your areas, mobilize yourself, and the assembly members will also mobilize, and the district assembly will mobilize to support you to put up a facility for your people. Again, the CHIPS compounds are to provide preventive health service. That means that they are supposed to provide immunization services for children, family planning to those who need them. They will educate mothers on nutrition, how to prepare good meal for your children so that they don't become malnourished and then they become stunted and do not develop well. Then manage common conditions. What it means is that when you are coming here, there are instances that they will not be able to address all your problems. It doesn't mean that they are not providing services, but that their capacity is to prevent ill health and to let you stay healthy. And it is cheaper not to fall sick and stay healthy. You can work on your farm, you can do so many things. If you fall sick and you even have the best of care, you are going to lose out in monetary terms and also time. So they will continue to provide these preventive services and manage common conditions like diarrheal diseases, malaria, and cough. If you report early and you're able to provide these services, you will not need to be admitted at a bigger health facility. But should you need admission, they will have to refer you to the next level. That means that as community health committee members, you should also be thinking about mobilizing yourself to make transportation available, especially at night. When someone needs to be moved to the next level, there will be a readily available transportation to convey the person. But we pray that once you accept preventive services and report early for treatment, there will be minimal need for people to be transported to the next level. I would want to end these brief remarks by indicating that if you were listening to the news, you would have heard that the country has reported cases of Lassa fever. It is also a disease caused by germ, viral disease. The disease survives in mice. We have so what I was saying is that Lassa fever is caused by a virus, and the virus is found in mice. And you know, when we store our food In our rooms, mice also live with us. So they come to share our food. And then they sometimes bite this food, leave their saliva there, or leave their droplets, their feces on top of our food. So when we take in this food, which is poorly prepared, and is contaminated by the feces and urine or saliva of these infected mice, we are likely to get a disease. And then we cannot be transmitting from one person to another. So we'll advise you to cover your food at night. Make sure your room or your environment surrounding is clean so that they don't attract these mice, and so we can all stay healthy. At the Regional Health Directorate, we continue to provide the support in terms of making available staff to continue to work in the facility. We also want to appeal to you, the elders. The staff who are posted here, treat them as your children. If you have any difficulties with them, draw the attention of their supervisors, but don't antagonize them. Let's work together. They are there to serve you. If there are any difficulties, let us know so we can take corrective measures to prevent abuse. But don't make their life difficult. We have always had difficulties posting people to the rural communities. So those who accept to come, let us work together to make their stay healthy and memorable, so that when they go, they can tell others how good we are as a community, to encourage others to want to come. I thank you all, and pray that God will bless us, and God will bless the memory of Dr. Bruce Ferrell. Thank you.
We also want to thank our partners for this kind gesture. In our Assembly member's speech, he mentioned a few things that I would like to touch on. He talked of a health facility that they would like to have at Tolibri. Honorable, I'm happy to announce to you that plan preparation stage for construction of a health facility at that place is far advanced. Currently, we are waiting for the budget to be approved, and when that is approved, the health center, the construction of the health center, you are aware that we are putting up a KG block there. Currently, it has been roofed, and we hope that in the next 1 month, the contractor will finish and then we'll hand over to the community as well. You make mention of street lights in some 3 communities which are not functional. I have taken note of it, and then I assure you that as I go back, when the chief executive returns, together we will see what we can do about it so that those communities will be hooked to the national grid. One thing you said that amazed me is the community spirit. I would like to thank all of you for your effort. What we are seeing is as a result of your effort that has made it possible. And if other electoral areas will emulate this example, I believe almost all the electoral areas and then the chiefs compound will have, that do not have maternity block, will all have one. So I would like to congratulate Honorable and your team for a good work done. On behalf of the Municipal Chief Executive, I would like to assure you that whatever it will take the Assembly to do such that we will be able to meet you at the point of your need. We will do that. Whatever project we have started will be completed. And as this one is also going to be handed over to you, the Assembly will also partner with the community and ensure that it will remain as it is for a very long time, meaning culture of maintenance will be observed. When the regional director was talking, he made mention of 11 chips that are not functional. And all this is due to the fact that there are no structures that are in place for staffs to be there. I've also taken note of that. And I think per our plan, if we're able to start the health center at Tolibre, it will reduce it to 10. And as you know, development is a process. So as we now know how many are left, as time goes on, we will remove them one by one. And every community or area will have their own chips.
Take the scissors together with the regional director and the chief and cut open. Okay. So you open it, you cut open this.
Dr. Bruce Ferrell, Center for New Life. Thank you. Opening. So nice.
So Adolfo Zenica, this is the delivery room. This is the delivery bed. So the ladies will deliver. They will examine the baby here. There's weight scale here. They will take the baby's weight. And then the next room now. I can't have an amazing power. I don't forget on the
But using batteries, yes.
Ola don't bother on there. Time I didn't hear you. I can't
So what we did was that we did a critical gap analysis. And those that we didn't have was what we did. So you have some that they are credit, you also have those expected for the delivery that was given by Bianca. So that one was really included in that. Delivery set? Yes, delivery set, that one too was supplied by Bianca, and they have to delivery set. So they switch the sanctioning machine. Or which for your situations.
That's great.
Yeah.
It's very nice.
You should be proud.
Thank you. You all should be very proud.
Yeah. And your life is smiling from the heavens.
Thank you. I appreciate that so much.
You're doing yes.
What, Jerry?
Yes, I'm the man.
Are you the midwife for here? Hi, I'm Britany. Regina. Nice to meet you.
How long have you been practicing? Where have you worked?
I've worked in Lawra Municipality for 4 years and I went.
I mean, as a midwife.
I was in Birmingham.
So after becoming a midwife, you just posted to it.
Congratulations.
This was because of the light issue.
Yeah.
It's not having light.
What about the other one?
It's not having light.
No, the other midwife.
She just came.
She just came.
On orientation.
It will still be good to spend a month.
Yes.
A month.
It's not out of place at all.
Yes.
To go back for.
Nice to meet you. Yes, exactly. This is my husband, Ed. Daniel.
Nice to see you.
And I put it as I'm going to Sunday now. And I want to say, which I will put on a puri. Take my time and a matter. I will turn as a quaint, do a lauta, a little a matana. If I bobble at a devil near the pobe, a tina yaina bola. At a maticana, a tearful. About it, to young and require more poor. I tell me one day you require more poor. I will not acquire over what I like. I want to be wise out like a tear never. Sitting by the car over. 2 hours. O car is here. I do not know to I will. I sure know she. I did not come out when I have a poor. I so. I you know it. I just bring out to Kuana. I just think I am allowed or in Europe. Now, where we are over was out like Japan, I yell now when people say, who you short a co at the chair, to dirty, the yellow apparition day, a chair flat to know who could at the Kanya. Tina Bernatinia, even at Tabby. I say, I yell, I never going to eat. I be tunga echewa. Young mamma and a pa, a cabana, shaving now. A bullet and a dish, an almond, Okobe and your Utoniwi. A very 30 tons or alena ina puro barka e pa kwa atem ania ma bena me ba wa kotia atemi wa po ti shura temi wa kanya a yen no be falo na ayi ashunta atome timi yele che bobra na ala wata bare ala hu bere be no bobra be no be bobra e je dia te sana sia ka atema ka vola pa ama ina mo kwaru no ni de kan bobro tasua e je oye se sa yelmbal a yernya bonga na ara la ni sa ku tumo ba tu be pole u euro atone asa ku euro be pore o de so na a yera nya me ka na ba no be yam ni sa ta ka wona bang na tin na ade chimba le chuta fula apobe mana le ademu ngale e ja bele dimna ina mana ya wa bara bela da tara sa tiro nga be yilo bat ere tieta chuta fula anga ne boben yel ko ni azi kina ibunga be yar yawo na to yalle de ta shi kan nye ser barka nye sana me abere to mi se tura ka atitabe na bibe konku yan wa pauti akala nye ser barka nye kinu tere yan fula
I don't know about the process. So that's the way I'm going to.
Tipuza pele na ondo bulo zore gore. Apa iti ondo bulo bire gore obezinezi beni. Aya titonya bafo yauna. Ondo bulo bire gire somi zore gore. Aya titonya bafo yauna. Bina bibiri akabara. Tina mi dona titonya.
I expect this one like this. Still good times.
Bedana ya tisono ya dota besira ya timalo ya bedana ya titome ya ndesiri wo na mtu akona chota kwa Efora posi wayani efora wayani
Yeah.
balena wando bulu gele aye atitonya malena wando bolo bale gilu to mi gele aye atitonya bafalana Atoza kwele pobe ndo yenile ati faro pondo yenuti tata Atoza kwele biri ndo yenuti tere ndo yenuti Atoza kwele pobe ndo yenuti tere Mini pondo yenuti tata
I've been working with Dr. Bernard Ziam, who is the previous district director here in the Lawra district for the Ministry of Health, and he let me know that there was a community called Tonga Zikpe that wanted to start a maternity block, and they were very motivated to do so. So in fact, they worked with the assembly member here to write a proposal to Health Resource Partners, which I'm the president and founder of the board of directors for. We were able to review their proposal, and along with their community contribution for time and labor, we were able to provide the funds to build this structure here. It'll help the community, as currently when women need maternal child health services, they have to travel a far distance and they might not have the money to do so. So now that we have this facility here, it provides greater access for prenatal care, birthing, and antenatal visits. So I served here as a Peace Corps volunteer in the Lawra district as a teacher from 2010 to 2012. And during that time, I had malaria, and I found that it was difficult to get access to care during that time, as I had to travel a far distance. So from there, I went to study public health to provide education for myself on how I could increase access. I've been in contact with the members of the community here since my service almost 11 years ago, and I partnered with many of them, including Dr. Bernard Ziam and Madam Genevieve from the Nandam district, along with Jeremiah, our country director, and we were able to provide the resources to increase access to this community. So the biggest challenges that the community has identified when they write their proposal tends to be maternal child health in these areas. So as our mission of Health Resource Partners is, together we find the way. So we always look to the community to let us know what they need most. And then we review their proposal to see if it aligns with our mission, which is to improve health outcomes in underserved communities, such as this district here. And they've indicated that maternal child health is one of their most underserved healthcare areas that they need to increase access for. So if the community continues to write proposals for maternal child health, that's where our focus will be. We're also interested in providing things like health and water sanitation, which we did during the COVID pandemic. We provided touchless hand washing stations. We provided solar lighting panels so that women can give birth in the night and still feel safe. So it's all community driven. So as long as the community initiates a proposal and it's something that we can work with them on, we're able to come together and provide access to those healthcare services.
My name is Britany Patricia. This facility is help us about when you are pregnant. The time that the facility is not there, we were always suffering. But now that the facility is there, we didn't suffer like that. Now that this delivering house has come, it will help us about delivering. Because the delivery house is not near here, it's a problem for us. We just break a law, like if a woman delivered in house, we will take that woman 100 Ghana cedis. Still, they still deliver it in house because the delivery house is far for them. So now that the delivery house is here, it will be good for us to do. Thank you.